Hey everybody, Craig here with Integrated Physical Therapy and IPT Virtual. We are your virtual place to go to for your home exercise programs. Something I've been hearing a lot lately in the office is low back pain, hip pain, and sacral pain right here in this area all together. And what I want to do today is show you a couple of exercises that'll help you treat this on your own from a stabilization perspective. Always we want to make sure that you do an evaluation that's appropriate, make sure you rule out all your red flags, and then I'm going to show you just a couple of really great exercises you can do to play with this. So we're going to move Fred out of the way here, and I'm going to hop up here on the table, and I'm going to be using a yoga block. And the idea here with the yoga block is to place one knee on the yoga block and the other one below it so that we can create a little bit of an offset on our hips. So I'm going to hop on here and I'm going to go on with my right knee so that you guys can see what's going to happen on my left side. So as I go into here, I'm going to bring my weight onto my right knee and my left knee is going to drop down and then it's going to lift up. Now this lift up process is supposed to be very small and very subtle. If you can imagine a glass of water on the small of your low back, we want to make sure that the hips don't move way too much or back and forth too much. So again, here it is, knee on the yoga block, one knee comes up. Now another thing you can add to this is when you come into neutral is you can do this fire hydrant movement. And this is the old movement to get those glutes to fire, but they're firing in a very stable position. So you can bang out anywhere between 7 to 12 of these on both sides. Okay? Now, if that exercise becomes too easy, another thing you can do is a similar thing, but in standing. So I brought a chair over, and doing the same thing, again, I'm going to stand on my right leg, and I'm going to bring my left back. And as I do, I'm going to lean forward so all my weight is on my right leg. I'm going to let that left hip drop down, and then I'm going to lift up and turn. Drop, lift up, and turn. You're going to feel this very deep, 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 deep into the hip rotators. Switching sides, left leg, I'm going to let my right hip drop, and I'm going to lift up and rotate. Notice how my weight is right over this leg. I don't want to drift over, I don't want to drift back. I want to make sure that I'm right over this leg. I can lean, let the right hip drop down, and then lift up. I can take it a little further, and I'll switch legs to show you again here. Lean, drop the hip, come all the way up, and then I can rotate even more. Now if I want to take it another step further, I can add resistance band. And the resistance band will go around me on the left side. And what this does, this is the anti-rotation part, right? So if I drop a hip and I come back up, it's that anti-rotation that we're looking for with those exercises. So that's 3 variations of the same hip stabilizing exercise. You can do these at home. Try them out. If you get a little confused, follow along with the video or give us a call here in the office. We'll take good care of you. Have an awesome day.